Every 3 years, the Southwestern Vermont Medical Center conducts a survey of the health needs of the region it serves, which covers not only Bennington County, but extends down to the Berkshires in Massachusetts and across into neighboring New York State. While you might think the main mission of the hospital is to provide treatment for those in need of it, increasingly hospitals are looking at the bigger picture of healthcare needs and how attention to wellness can help keep people out of the hospital in the first place. The COVID emergency has also thrown this into sharp relief. Living conditions, mental health, housing, and even transportation needs can have an impact on the person's overall well-being. The medical center is in the middle of a series of 5 online community forums to hear from area residents divided by the coverage area, and the first one kicked off on March 23rd with a focus on the North Shire. Information and opinions will be collected using a digital survey as well as through the series of virtual community forums. Rory Price, SVMC's Coordinator of Population Health and Grant Administrator, conducted the North Shire discussion, and afterwards we had a chance to ask her about her takeaways from that.
I mentioned it was a pretty broad survey of the health needs that are facing the North Shire. So some things that were mentioned were affordable housing, substance use, and then kind of the merger of those two topics in the form of recovery housing, and the lack of availability of recovery housing in the North Shire. Childcare was mentioned, as well as adverse childhood experiences that might be exacerbated by COVID this past year. So things like domestic violence or abuse within the household that can impact a child and really impact the trajectory of their life. So this group that we met with last night was really focusing on these such important topics, and I was glad that everyone felt comfortable sharing those things that might be facing their community. At the end of the night, we did have a poll to try to kind of put a number on what folks wanted to see prioritized for the coming years. So overwhelmingly, mental health was the top choice of attendees at the North Shire Forum. And I don't want to preempt results for other areas, but I know that across our health service area, that is something that every community is facing. The group also prioritized affordable housing, substance use, and transportation as topics that they would like to see addressed in the coming years. So our process now is to continue these forums in our other service areas and then kind of build a broad picture of what might an action plan look like across our whole health service area, while still keeping in mind that certain geographic regions within that broader area might need a more tailored approach.
The results of this year's survey differed slightly from the results they obtained in their previous community survey conducted 3 years ago, she said.
It was a similar conversation. So our last community health needs assessment took place in 2018. And the 3 priorities that were identified across our whole health service area were access to care. So within that, we bundled access to primary care as well as access to any specialists that might be needed. Substance use and mental health as sort of a combined topic to address, and then healthy behaviors and obesity was the 3rd priority area. So our conversation last night, while it was similar in content, the end result was a little bit different from previous years in that transportation and housing took, I think, a stronger, were identified as a higher priority than they have been in the past.
Surveys have since been held for the Berkshires, Deerfield Valley, and the Hoosick Falls, New York area, and the final one will focus on Bennington and the South Shire on April 6th. You can visit svhealthcare.org/classes-events to register to attend that community forum. A report summarizing the findings will be made available later this summer or early fall. For the GNAT-TV News Project, I'm Andrew McKeever.